be on parenting with a disability, psychosocial considerations. So Gabriella Carafa is a social worker certified in perinatal mental health. She has over 7 years combined experience working with individuals with disabilities and complex medical conditions, as well as supporting individuals in the perinatal period. She works with children, adolescents, adults, families, and couples in her private practice. And she has a special interest in parenthood for folks with disabilities, including physical, intellectual learning, and/or episodic disabilities, and has her own lived experience of disability. Gabriella is passionate, about sharing knowledge and experience by providing content, interviews, professional workshops, creating invited blog content, and leading healthcare with social services training opportunities. Gabriella brings in a diverse, unique, passionate, and vibrant voice to the realities and intersections of mental health, ability, and the perinatal experience. So I will hand it over now to Gabriella Carafa. Thanks so much, Gabriella.
Hi, everyone. Thanks so much for having me. Okay, so this is just a brief outline of what we will be discussing today. I'm going to tell you a little bit about myself, some grounding principles of this presentation. I'm going to chat a little bit about barriers to parenting with a disability, perinatal mental health and disability, accessing a social worker or therapist, planning for parenting with a disability, and considerations for service providers. So who am I? So I identify as an individual with a disability. I use a power wheelchair for mobility. I'm a social worker who is certified in perinatal mental health. I've also taken additional courses that include postpartum doula, DBT for complex PTSD, mental health and developmental disabilities. I've taken training and courses related to responding to previous sexual assault and domestic violence in clinical settings. I received my MSW at U of T, and I attended York in my undergrad, where I completed a specialized honors degree in psych and rehab services certificate. I've always been interested in pregnancy, childbirth, and parenting, even as a child. Currently, I work in 2 acute care hospitals, a pediatric rehab facility, and started my own private practice, specializing in perinatal and working with individuals with disabilities. I also wanted to say that and let everyone know I am not a researcher, so I'm coming here as an independent clinician, speaking with my own lived experience with disability, a disability affirmative therapist, and a social worker working in this field. And I wanted to spend just quickly on this slide some time talking to you about what my role entails as a perinatal social worker. So the 4 main aspects to my role are provide therapy, provide psychoeducation on perinatal mood and anxiety disorders, the effects of trauma, what to expect at the hospital, baby care, and healthy relationships. I connect families to community resources and supports, and I advocate with and on behalf of individuals and families. On the next slide, we're going to talk a bit about intersectionality. We really can't move forward without first addressing intersectionality. So of course, this presentation will be focused on people with disabilities. However, along with identifying as having a disability, an individual has other identities that impact how they experience care, how they access support, and how they feel as parents. And so when we're thinking of intersectionality, we're recognizing that people are disadvantaged due to multiple sources of oppression. And so that can be their race, their ability, their gender identity, sexual orientation, religion, and other identity markers. So when we're thinking of a person with a disability, we just need to keep in mind that they have other identities as well. On the next slide, we're going to chat a bit about, disability and access. So I wanted to just highlight that when I'm saying disability, I'm really thinking of it in very broad terms. So it's important to acknowledge invisible and visible disabilities, including learning, intellectual, and mental health conditions. Disability can be stable, episodic, or progressive. Sometimes an individual is identified as having a disability, but the society would not really label them as having one. And sometimes society would label somebody as a disability where the individual does not feel like they are disabled. I wanted to chat, and a lot of it did come up in the previous presentation, around common challenges faced when planning or becoming a parent. So we already know that there is like a limited, sorry, I have a bit of hiccups, limited representation of accurate depictions of individuals with a variety of disabilities in the media. We know this. This is very much true if we're thinking of representation of disabled parents in the media. There's physical and attitudinal barriers when accessing care, resources, and support. They face negative reactions when disclosing a pregnancy and desire to become a parent to their healthcare provider, family, and caregivers. There is an overrepresentation with CAS, both as parents and as children when you have a disability. Persons with disability are more likely to be survivors of trauma and have other mental health concerns that can impact pregnancy, childbirth, baby care, and parenting. There's a lack of disability affirmative training for service providers. So my experience comes from additional courses I have taken, my lived experience with disability, and having friends that are parents with disabilities. This was not something that is part of any formalized training in school. So somebody would have to seek out specialized training in working with parents with disabilities. Certain services that are available, they only address one specific area or identity. Services are not typically intersectional. So many organizations exist to support differing identities. However, it's rare that people feel supported in all places. So for example, you have services that target physical disabilities and have made an office wheelchair accessible. However, the services they provide do not address other disabilities or identities. There's a lot of fears around disclosing invisible disabilities and asking for support. So my disability is very visible. I always say, when you meet me, you know, I use a wheelchair, I can't really hide that. With individuals who have invisible disabilities, there's a lot of fears around disclosing that. And, you know, it's really difficult because if they've had negative experiences with not being accommodated previously when they disclose, or having assumptions made after their disclosure, they're not going to disclose the kinds of supports they need when accessing any kind of reproductive care. And so, you know, an individual may have a learning disability, and we're giving them a whole bunch of handouts and having, you know, certain conversations that maybe, you know, they need more time to have these conversations. And they know this, but they're not accessing that support and accommodation to do that. So they're not getting the information in a format that they understand. Linking to this idea, there's a tremendous fear around asking for support, as it may mean further scrutiny and discrimination. And I can't tell you how many times my friends with disabilities have asked me questions opposed to the social worker that's on their team. There's been many times where friends with and without disabilities have shared their challenges coping in the postpartum period, but we're afraid to reach out for help because they're worried about how that might be perceived. A person with a disability is already experiencing people around them telling them not to have children, that they're not able to manage. So expressing that things are difficult or they're not coping emotionally can be really scary. And there's a lot of fears around having children's aid involved and having children apprehended. But not asking for the help heightens the risk for the individual and that child. So my hope in my role is to bridge that gap and to normalize asking for support. There's not really a clear understanding of the role of a social worker and the role of CAS, which is a challenge and a barrier for some people in accessing support. And then, you know, the important point that, you know, individuals with disabilities are at a higher rate of experiencing trauma and mental health concerns. And this rate increases if we're talking about individuals with cognitive disabilities, racialized individuals, and those who have comorbid disabilities as well. Many individuals have heard of postpartum depression or anxiety. I like to say perinatal mental health and anxiety disorders or symptoms because it encompasses pregnancy and postpartum. And so it looks at it much more broadly. Having a disability itself does not necessarily make you high risk of having a perinatal mood and anxiety disorders. However, we need to understand that it's the other things that disability impacts that make someone at a higher risk. So financial difficulties, isolation, lack of support, transportation, access issues. And so we spoke earlier about how people with disabilities receive those negative reactions, and that they're likely to be survivors of trauma, and they're also more likely to have anxiety and depression. So when we're looking at this as a whole, we need to understand that we're looking at perinatal mental health. We're not only looking at what makes someone more at risk of developing perinatal mood disorders, but how we can actually address these needs. And this is why it's so important to encourage people to reach out if they need help. There's a lot of literature that talks about how people with disabilities have a lot of medical trauma and have experienced things in the healthcare system that again may happen again when they access care through reproductive services. And they may feel re-traumatized when they enter that healthcare system as someone either trying to get pregnant or pregnant. I wanted to spend some time chatting a bit about meeting with a social worker and how can you make sure that you're going to get the kind of support that you need in terms of planning for a baby and getting that emotional support that everyone in this period would benefit from. And so there's a lot of fear, like I mentioned, around CAS and social work and understanding their role. It's important to access supports that are available around you and to feel like your supports are actually meeting the needs that you have and not assumed needs that you might have. So how do you get comfortable doing this? So if we think of like a scenario, so someone on your healthcare team encourages you to meet with a social worker, or maybe you want to meet with a social worker. That is something that could possibly come up when you become pregnant or you're thinking of having a child or becoming a parent. Meeting with a social worker is voluntary. Sometimes in my role, I meet with people once, and sometimes I meet with them several times during their pregnancy and in postpartum. The role of the social worker can vary depending where you're accessing care. So for example, in a hospital, in a community setting, in a private setting, and that context where you're accessing that care can affect the length of involvement, the services provided, any potential fees, waiting lists, scopes of practice. So it's really important to clarify what your social worker therapist role is on the team. There are certain questions you can ask your social worker or therapist that can help to determine if that's a good fit for you, or to help gauge whether they have any experience with disability. You can specifically ask them, have you ever worked with somebody with a disability before? What was that like? What did you learn from that experience? To get a sense of maybe they don't have any experience and they'll tell you that. And that doesn't necessarily mean that they're not a right fit for you. You might want to ask them, other areas of your identity that are important to you and their experience with that. And be transparent about what your concerns are working with that social worker or therapist. You can ask questions like, what can you expect, when you meet with them? I've been asked my experience with disability, how long I've been in the field, how long the session will be, and what kinds of things will be discussed. Sometimes it's really good to think about whether there are like documents or articles or papers you want to share with your social worker or your healthcare team to help them better understand your situation, whether that's your diagnosis or your life circumstance. And so, for example, I work with individuals from a variety of cultural backgrounds. Sometimes, they've asked me to look a cultural practice up for them or watch videos to help me better understand, what they're experiencing. And when we're having that conversation, I have that level of awareness. Most social workers and therapists will complete an assessment, and that word itself, an assessment, can be quite stressful. What exactly are we assessing? Again, it depends on the setting. You can ask that question, though, to your social worker or therapist. What are you assessing in this appointment? When I think of assessments, I always see them as like ever evolving, right? So it's a way for your social worker to get to know you, your situation, your history, and how best to support you. In my role, I explore what your presenting concerns or questions are. What are some of your informal, formal supports, your living situation, your financial situation, your hospital discharge plan, any kind of mental health history that might be relevant that you want to share, any substance use, prescription or recreational, previous, current child protection involvement, and your relationships if you're in one, in terms of like whether it's safe, and speak to you about any kind of like previous losses you may have experienced and how that can impact your pregnancy now. There's usually goal setting, and so whether that is setting goals with your therapist, but that could look like connecting to supports, that could look like going for ongoing therapy, that could look like having other agencies involved. So for example, I've worked with individuals who were survivors of sexual assault, and we've connected them to trauma counseling, made a birth plan with them, made sure the team was aware with their permission how much they wanted to share, of like how to approach them during the admission. So these are certain things that a social worker can help with individuals that may need, I've worked with individuals from the deaf community, and they need like an ASL interpreter and a deaf interpreter at times. And so making sure that that's all arranged, and that individuals on the team know how to get an interpreter when needed, and quickly, and what the plan is while they're admitted. Of course, anytime, there is some sort of an assessment, especially in the hospital, we are assessing for potential risks. But working with a social worker during your pregnancy can mitigate some of those risk factors and fill those gaps in care. So again, if you need certain equipment in order to take care of the baby safely, it's like connecting to an occupational therapist to assist that. If you need ongoing counseling because you do have a history of mental health concerns and that's something you want to do, then connecting you with that. Okay, so the next slide, just scrolling down as well. So whether you are a person with a disability or you're working with a parent with a disability, it's kind of hard to know what areas you might need support in if it's something you've never experienced. So the slide says like you don't know what you don't know, but you do know a lot of things. And that can be really stressful to try to imagine what things might be like and, worry that you have to have all these bases covered. But just like parenting, there's going to be a lot of unknowns. And it's hard to plan everything as a prospective parent. So you can start by thinking about what would be important when having a child. If this is difficult for you, ask someone you trust to help brainstorm some things. Think of a previous experience in your life where you have had to ask for accommodations or advocate for your needs, and are any of these relatable? What strategies have worked in the past for you? So some people audio record their doctor's appointments with the doctor's permission, or just a summary of what they need to follow up on. Someone who can write notes for you during the appointment, visual schedule for baby care, getting extra time for your appointments, just like, extra time when you wrote exams. Like sometimes we need that extra time, whether it's for physical reasons or cognitive reasons, or it's anxiety, or it's a combination of all of these things. And that's something you can advocate for. And a social worker can assist you with that as well. And again, we talked about equipment, so connecting with an OT. Really, really important, and it was mentioned in the previous presentation, connecting with peers who face similar challenges can also be helpful to brainstorm possible solutions, and to feel that sense of community. Build those connections as soon as possible is really my strong recommendation. So if you're thinking of going down this route, how are some ways you can connect with other people who have also maybe share a diagnosis, or you feel have similar experience of you that you can learn from each other. If you come across an article or something that you feel fits your experiences, share it with your healthcare team. And thinking about coping strategies. So what have worked in the past? So was it medication? Was it therapy? Getting physical activity? And that may be the same coping strategies that you use during your pregnancy and postpartum. But sometimes coping strategies that you used previously are not transferable, or they're just not working anymore. And we're always challenged, everyone, to come up with new ways of coping with stress and anxiety and, different levels of emotion. And so we may have to learn new coping styles and coping strategies. And that can be really difficult for some people. And it's okay to say, my old coping styles are not working. I need some support exploring some new ones and trying different things out. And I recognize in saying all this, it's hard as a person with a disability to always be the one having to advocate for your needs and, educating other people. On the other hand, I'm also very passionate about that education piece for healthcare providers, and thinking really broadly of parenting with a disability and what that means. And really recognizing that, nothing should be created for us without us, and we need to be at the forefront of not only just the creation of something, but we need to be there in the ongoing development of that, providing services. And we also need to take care of ourselves in the process, because as I said, it can be really exhausting for individuals to always have to feel like they have to constantly advocate. The next slide is more for service providers and things to consider. And I'd be happy to know if anybody, during question period, if anybody would want to add to these as well. But this is the stuff I've heard working with individuals with a variety of disabilities. And, this is something that we should all do, regardless of your scope, your role in your organization. We need to recognize as service providers, we all have a different level of experience working with people with disabilities, and that's okay. The first thing is, check your bias. So if you're aware of your hidden biases, you can monitor and attempt to ameliorate them before they're actually expressed outwardly to somebody. It's really hard. There's a lot of activities to try to uncover what individuals' hidden bias is, but it's really important that healthcare providers spend some time reflecting on what that might be. And again, it's also related to the lack of representation, and it's related to the lack of education as well. And then understanding the reason for the referral. How do you think you can be helpful? Can you be helpful? Are you the right person to see this individual? Gain a better understanding of the diagnosis. So take initiative yourself as a service provider to better understand. Ask the client directly, is there anything you want me to read? Is there anything you found helpful in the past that you can continue to do moving forward? Learn from the individual. They're the expert. They have been managing this long, and they are problem solvers. And consult with community agencies as needed. You do not need to be the expert in everything. And I know that that's hard for a lot of service providers to admit that maybe, they don't know. And they might need help figuring out from other agencies how best to support whatever the goal is. There's things that you can do regardless of whether you know that someone is identified as having a disability or not. So as I said, sometimes it's visible, but sometimes it's invisible. And there's just many ways that we can accommodate the clients that we're working with without, having to know what their diagnosis is or, what are some of their challenges, by giving individuals options. So would you, for example, do you want me to email you the handouts in case they, they want that in email? Would you like me to explain the handout first and then give you a hard copy? Do you want just a hard copy, read it over and ask questions? Like, this is just a simplified example of how we can be accommodating all the clients we work with, whether or not we know that they have a certain diagnosis. I've been asked for things to be in certain formats, certain sizes, different languages, videos, providing summary, writing people down a list of things that we've applied for already so that they can share that with other people who are involved in their care, and incorporating coping strategies within sessions, like starting with mindfulness, so that, we're able to kind of manage that anxiety before the session started. So these are things we can do as service providers without having to have all this information about somebody. And it sounds like it's a lot, to think about the way you practice and find ways where maybe, individuals with disabilities would not feel like they're being supported, and figure out how best to do that. It's about being open and willing to adapt the resources you give and being open to explore a lived experience that you do not have. So not only trying to understand disability itself, but trying to understand this individual's life. And my final point, which was highlighted earlier, is to start early. So make conversations to start around sexual education, gender identity, reproduction, relationships, and parenting. The stuff, as we know from research, that it's not being talked about in the same way when you have a disability versus when you do not, or it's not really something that is applicable in that situation. So there's this assumption that, you know, people with disabilities are asexual, that they're, you know, never going to have kids, so why are we talking about it? You know, they don't need sexual health information because maybe, you know, people assume that they have, you know, cognitive issues and therefore they're never going to experience that. So it's about finding those opportunities and creating those opportunities to have those conversations from as early on as possible, and involving parents who have young children with disabilities in that really early on, so that that becomes a regular part of discussion, and it can be adapted based on the individual's age or developmental level. I'm just looking at the time. I did have I think I have a scenario next, and I didn't know if it was possible to go through that and have individuals respond. But this is a situation that actually did happen, and I have permission to share it. A couple in their 30s, they both have invisible and visible disabilities. First baby, they were asking repeated questions about baby's care and attentive to baby, coping well with the admission. And the nurse stated, tomorrow the social worker is coming to see you because of your condition. So what questions would you ask the nurse? And I didn't know if it was possible to have people answer this question.
Attendees can answer in the chat.
Oh, perfect. Thank you.
No problem.
Maybe I can ask another question. So what's highlighted here is they're asking a lot of this repeated what do you mean by condition? How is that relevant? Yeah. So that's something the nurse said. So you're to ask back, what do you mean about the condition? How is that relevant? Yeah, definitely. So there's a lot of reasons why someone might be asking repeated questions. They're not getting the information in the format that they need. They're anxious because it's their first baby. They're worried, and they, you know, there's a lot of normal anxieties around having your first child. But it seems like, you know, they're coping well, and there's this automatic like, oh, well, you know, they have a disability. They need to see the social worker, right? And so I would wonder if this is a normal occurrence for all parents that the social worker is called. Yeah, exactly. And it's usually not, we don't see everybody on the unit. And it doesn't mean that they wouldn't benefit from learning about community resources, but even asking, you know, clarifying questions. So what do you mean by my condition? Or what does that mean? Or what do you think the social worker could help with? And in this case, the couple who knows me decided not to see the social worker, and and then called me, and, you know, it was really distraught. And so I feel that this is something that happens quite often, where nurses and other healthcare providers are not very explicit of like how they think the social worker could help, and they have their own biases. So they've just met this couple and they're assuming that, you know, they're not going to be able to cope, instead of asking, hey, like, you know, I noticed you asked this question a couple times, like, you know, are you worried about something, or is there a better way to like write this information down, or tell you this information? Like, it's okay that you're asking. I want to just make sure that, you know, we're able to support you the best way. So it's not this automatic jump to seeing the social worker. And it might be, yeah, to connect, to show you some resources in the community, and then that individual can say whether yes or no, that they want that person involved. And if you were the healthcare provider, right, there's certain things you might want to ask. So, you know, I would need more information, like, well, what's actually happening? And has somebody, like, do we know that, you know, this individual has a history of anxiety, let's say, and do they want to see social work? Because, you know, it is voluntary, and wanting to understand what the nurse is observing and what is so concerning about that. And then we can go to the next slide and just around key messages. So accessing available support, ask questions, and building your community, and take someone with you to your appointments if you find that that's helpful. Some people find that beneficial and some people don't. This is just things that I've heard, over the years that has been helpful. And I know with COVID, there's a lot of restrictions on who you could take to your appointments. But if you have a disability, they do have to accommodate you. So you can just identify that that is your support person and you need an accommodation. So despite the COVID rules, you're able to bring somebody to the appointment. And then the last slide is just my contact information. If people want to email me, they can email me. I'm pretty quick to respond, or I'm happy to answer any questions here.
Thanks very much, Gabriella.